Hi everyone, this is Dr. Shinesfar with Unity Physical Therapy, and today let's talk about how to use your crutches properly if you've just had surgery. We're going to cover four main topics. Firstly, how to properly fit your crutches. Secondly, what these different weight-bearing precautions mean. Thirdly, how to progress in the crutches journey. And fourthly, how to go up and down stairs. And a very important reminder, always follow your surgeon's specific instructions. This video is educational purposes. I obviously don't know the nuances of your case, so this is to help inform you and educate you, but your surgeon's instructions are always what come first. So first up, let's get into it about fitting your crutches. Crutches that are too tall or too short can cause some problems, from a little bit of arm irritation to even some nerve issues by putting too much compression in the armpit. It can also make it feel awkward and less stable when you're walking forward. So firstly, you want to stand tall with normal posture, looking forward. The top pad of the crutch should sit just a few fingers underneath your armpit. You should not be resting your body weight directly on your armpit. Now let your arms fall down, your elbows just slightly bent and not locked out. And with your arms hanging by your side, the handle of the crutch should just be right around wrist level. This way your hand can just naturally grab onto it and put a lot of the weight through your hands instead of your armpit. If you feel pressure in your armpit, the crutches might need to be adjusted. And secondly, many people like to buy different padding because sometimes just the material on the crutch can cause some irritation right around the armpit area. Next, let's break down what these weight-bearing terms mean. And after every surgery, you might have different weight-bearing terms and precautions. So firstly, we have toe touch weight-bearing, which is not walking on your toes, but instead you want to think of your surgical foot as really just for balance, and we don't want to rely too much on it. Think about you're literally walking on an eggshell, so you don't put any more than 10% of your body weight, which obviously is a really hard thing to measure. So when in doubt, put even less weight on it. Your leg is basically going along for the ride and the crutches are doing the work. After that, we have partial weight bearing. This is where you're allowed to put a limited percentage of weight, somewhere between 25 to 50% usually, and you should still be using the crutches to unload your leg. A lot of times the therapist will tell our patients to first put weight through their hands and then let their leg come and unload it a little bit. This is the phase where people start retraining their brain into proper walking patterns. Again, make sure you follow what your doctor or PT tells you, especially as you progress through these phases. And then lastly, what we have is weight bearing as tolerated, which means you're allowed to put as much weight you'd like on your leg. And really, pain is going to be your guide. The crutches are really just there as support and balance. And you're allowed to load the leg, you just don't want to put so much weight in that it causes pain or causes you to limp to make the symptoms worse. Now let's talk about how to progress your walking in these various crutches phases. This is especially when you're in the weight bearing as tolerated phase. We'll go step by step through each pattern. Firstly, we have the classic 3-point gait pattern. This is what you see most people do immediately after an injury or immediately after surgery. People put both crutches down in front of them, put their weight through it, and let their legs swing through and landing on the non-injured leg. Your injured side is not putting any weight on the ground or resting at all on the ground. And now that we're gonna put some weight on our foot, this is where things get a little bit more interesting. First, we're gonna start with what's called a step 2 pattern. This is where the surgical leg is going to start to begin to accept some weight. So we're in the partial weight bearing to the weight bearing as tolerated phase. So for this, first you're going to stand on your non-injured leg, let the crutches go first, and then let your injured side put some weight, and your non-injured side is just going to step to match this injured side. You're not going to let the uninjured leg pass in front. And as you get a little bit better, you can reduce the time between your crutches going and then your injured leg, such that the crutches lands a millisecond before your injured leg, and then your uninjured leg steps and catches up to the injured side. Really, you can think of the crutches and your injured leg as one unit. They're always going to move together. But in this case, the crutches may go a millisecond beforehand just to take some of the weight off. Now what we have is called a step through pattern, and it's exactly the same as a step 2 pattern. The only difference is now the uninjured leg will pass the injured leg to step in front. So from the beginning, you'll start with all your weight on the injured leg. You'll put the crutches a millisecond before your injured leg down. Put some weight through those crutches depending on how much weight is tolerated. Then your uninjured leg is going to pass your injured side before you step down. This is why we call it a step through pattern. This is where things begin to look a little bit more like normal walking. Now what we have is a 4-point pattern. This is where things get a little bit tricky, but once you practice, it's a nice in between to progressing to the next phase. So how it's gonna work first is this. Your crutches are now gonna move independent of each other. So first you can have your weight even between your feet. First, you're gonna let the crutch on your uninjured side go forward. Then you're gonna put your injured side forward, and then the same side crutches your injured side right after that. So the cadence of it really is like other side leg, same side crutch. And then you can let your other leg go forward and repeat. So it's gonna be non-injured side crutch, injured leg, injured side crutch, non-injured leg. I know it's a mouthful, but as you get better at it, it's gonna allow you to start working your arms independently, more like normal walking. From there, you can sync up the opposite hand and leg together so that they move in unison, sort of like normal walking. Because as you can see in normal walking, when your left leg steps forward, your right hand swings forward, and vice versa. So now instead of doing it where it goes crutch, leg, the opposite crutch and leg can move at the same time. This creates a more natural walk pattern and allows you to start shifting more weight onto the injured side. Now next, we're gonna begin to wean off one of the crutch, and now we're only gonna have one in one hand. We're essentially gonna do a modification of that 4-point gait that we just did, except with one crutch. So you're gonna have the crutch is gonna be on the uninjured side, so opposite of your injured leg. You're gonna move that crutch forward, then your injured leg, and then let your non-injured leg catch up. Same as that step 2 that we did earlier, and then eventually we can go to the step through. So one more time, it's gonna be crutch, injured leg, and then your non-injured leg is gonna catch up. And then lastly, what we're gonna do is essentially have the crutch and our injured leg on opposite sides of each other, but move together as one unit. So the crutch and your injured leg will both hit the ground at the same time, and then your other leg will move forward, like normal walking, but just with the assist. And then lastly, if you still need some help with regular walking, you can use a cane so that it accepts some of the weight, but it's essentially working like a crutch as you have been. Now that we've talked about the progression of using crutches, let's talk about how to use it on steps, curbs, and stairs. This is often really intimidating for people after surgery, because rightfully so, we don't want to create any falls. So rule number 1, if there's a handrail, use it. If it's properly applied, it should be stable and mounted and more stable than the crutch. And you can carry the crutches in the opposite hand as the rail, or you can give the crutch to a friend and do crutch and rail together. And the second rule to remember, and the adage is up with the good, down with the bad. And in order for some people to help remember this, in grad school I was taught the good go to heaven, the bad go to hell. So up with the good, down with the bad. But more what it means is the good you can think of as the uninjured side, and the bad is the injured or post-surgical side. And so when you're going upstairs, you're going to lead with the uninjured side. So meaning you're going to use the handrail or crutches, and then let your uninjured side go up on the step above you, let it accept the weight, stand up, and then have the crutches and your injured leg match you on the stairs. So once again, in this case, if my right leg is injured, my left leg will go up the stairs first. I'll be putting weight on the crutches and the handrail, and then I'll put the weight on my left leg and my right leg will match it. You can obviously switch that if you've injured your left leg. And then when going down, we're going to lead with the injured side. So it's gonna go injured side and crutch first so that my non-injured side can take a lot of the weight, put the weight through my crutches and injured leg, and then my leg can match it. So in this case, if my right leg is injured, I'm gonna reach with my crutches, again, using a handrail if I have it, go crutches and leg, and then let my left leg come forward. I hope this helps educate any gaps with how to use crutches after surgery or an injury. As I mentioned before, always follow your surgeon's precautions. And if you like this video, please subscribe for more educational content on everything from post-surgical to physical therapy tips and corrective exercises. Thank you all for watching, and good luck on your fitness and rehab journey.